Good morning, my dear students. I'm Dr. Al-Taweel. Today, I would like to continue our talking previously about the research writings. I'm talking about on behalf of my colleague Dr. Anas on the research writing parts that we talked previously last week's, starting with the abstract and titles, methodology parts, and this part which is about the result one. The result chapters I always personally consider as a very dynamic and important part of your thesis, and even when you publish a paper, because it's about your findings. It's about the new things that you want to deliver to the readers, and it doesn't matter if it is about if it is novel or not, if it is new or not. But the things that you tested before. When you work with your topics and you want to deliver it successfully, I think this chapter is going to help you to find the basic things on how to present it in a way that it make it successful and easy to follow and solely objective to the reader. In result chapter, all findings of the laboratory, it depends on your study, if it is laboratory or clinical investigations, are reported objectively. Normally, it consists of text, tables, and figures, which should be concise. And this conciseness is very important because sometimes, unfortunately, we found a lot of students when they talk about certain facts or data or findings within the text, and when they reflected as a table or figures, some of the number are not matched exactly or not the same, and even sometimes when returned to that numbers in the discussions or previously listed within the abstract, it is not the same. So it should be all the facts when you talk or when you present your numbers, it should have the same things. Try to avoid interpretation and report any data necessary to prove or disprove the study's hypothesis. So remember, it's about your study hypothesis first that you claim about. When you test your aims, whether it is the primary one or the secondary one, remember those data and those testing that you did according to the variables available you want to show. It should have to present it in a way that you feel it is necessary to prove or disapprove according to your claim as before. Don't shift away or distracted your results in a way that it might make a confusion to the reader or even to the audience sometimes when you present it in an audience. In a conference or the webinar or etc. So these things very important. You have to remember is about reporting those data objectively according to your hypothesis. The chapter should follow a logical order. It's not going to be presented in an arbitrary way or as you want to do. There's a certain sequence or order you have to do, and according to one of those options are presented in the following tables, either in the chronological order, grouping by topics or experiments, general to specific, or the most to the least important. Okay, and we were going to talk in details about each one to see which one suits your need to present and to make it successfully presented. Regarding the chronological order, the most straightforward and the most commonly used one, when the data presents in a sequential subheading similar to that presented previously in the method chapter. That means that when you presented certain topics or when you talk about certain things in the sequential order within the methodological chapter, and you did your analysis with those heading or subheadings, you need to present them. If you chose the chronological order, which is the favorable one according to that data, you have to show them in the same way, in the same sequential order that you did within the methodology chapter. The advantage of this one is going to be so easier to the reader if he want or she want to match exactly what you find according to what you test in the same order. So without going back to the and remember what you did in the methodology. So you just did it doing the same way that you did it in the methodology chapters to make it more easy. The second one, the topic or the study group experimental measured parameter. For example, I can explain this one by listing this example to make it easy for you. If we want to talk about the comparison, for example, a comparison study of the sealing ability, antimicrobial, the cytotoxicity, and the bioactivity of three root filling materials. If we won't do that in a way that the results grouped by the type of the root filling materials, so the main comparison going to be about the type of the material. So we have three materials. The first one is about something, the second about the other one, and the third material is about different one. So the difference is going to be about the type of the materials, but when we compare those variables according to that materials, it's going to be the same. So we have the things that we're interested in is about the sealing ability of the first and second and third, the antimicrobial between those, cytotoxicity, and the bioactivity. This order allows the reader to identify the results of each one as a full package of information. So it's going to give you a full description about each one in the same graph or either within the table. It depends on which way that you want to present. Okay, this is if we want to talk about the type of the materials. But if we want to talk it in a different way, grouped by the measured parameters, it's not about the type of the materials. It's going to be the main things about, for example, the sealing ability, the difference between three of them, the antimicrobial, the main things on the difference between them, the cytotoxicity, the difference between them, and the bioactivity, the last one. This order emphasizes directly on the similarity or difference between the different root filling materials in each tested parameters. So it's going to focus objectively on each parameters in terms of the similarity or differences. So it is a different way to present, but it's give you the idea about the things specifically about each things, each variables specifically you want to compare between different kind of material. The third style is about the general to specific. This style of result is most commonly used specifically in the clinical studies, including multiple groups of patients, for example, receiving different treatments. Generally, we talk about, for example, about the overall populations, for example, the demographic presentation, and mostly comes as presented in the table. For example, such as sex, age distribution, different things that you want to describe those population. Initial and final numbers in each groups, and if there's any kind of a dropouts, which should first introduced. After that, the data and results of each specific group, instead of the overall talking about the general one, you will go to the specific group is presented. Started with, for example, the control one, or the group that receiving the standard treatment, or the placebo we call it in the clinical studies, followed by the results for the disease group or the group receiving the experimental treatment. So it's give you a specificity about your population following talking about the general one as a demographic presentation. Okay, the last one, the most to least important style, it depends on how much critical is your study is. If the result is not critical in your study, you can present it in this way, from the most to the least important, with the highlighting the results that you want to emphasize. So this style could be used actually, but I don't think that in each kind of thesis or the papers there's a certain level of the critical things that you want to just ignore. You need to present them according to the importance. For example, you can't do that, but for our fields and the medical fields, we're dealing with the clinicals or the experimentals or in vitro studies. So I think other styles going to be more fit to you. But anyway, the most least important styles sometimes could be used if you talk about specifically in certain parts of those subjects, specifically in a non-objective way. If we want to talk about the data and the results, a lot of students have a confusion about the meaning of those two terms. Very simple speaking about the data represent the facts and number presented in tables and figures, such as the age or the age of the blood samples, the gender, for examples, or the presentation or the summarization of those data in a term of the mean, median, standard deviation. All of these we cannot call as a result because it is a descriptive term of your population about their general facts. We didn't do anything with them. For example, the age of your population is about that. We didn't run yet our testicle analysis about them. Okay, so it is kind of raw or unsorted, explained kind of data. So we call the data. But the results or the findings are the statements, represent the statements in the main text that's summarizing and explaining what the data show. And normally it's come following certain processing of doing the statistical analysis of processing or manipulation of your data in a way to be more organized and sorted. So this is called results, and depends on the test that you want to do. For example, if you're doing a comparison or association or doing a regression analysis on, it depends on your sample, if it is have a parametric or non-parametric values on the normal distribution or not normal distributed, etc. So those kind of testing that you want to do with your data, it's called the results or the findings of your topics. For example, this, according to that study that done by Nestle to 2010, he just discussed or described the 2-year survival rate of patients with neuroblastoma treated with neuroxumab, plastide, and radiations. So this graph representing the survival rate, for example, here in the y-axis, the survival rate percentage, on the on the x-axis, which is the time after treatment. So he just presented that fact according to the survival rate according to the time after treatments. Okay. So the figure and table shows the survival rates following the diagnosis and initiation of treatment in the 3 treatment group. At 6 months, the survival rates were 95% for the neuroxumab group, 91% for the plastide group, and 39% for the radiation-treated group. And then he said that at 12 months, the rates were 83%, 69 and 23. At 18 months, 74, 17 and 15, and 24 months were 17%, 11% and 9%. If we focus very precisely on those graphs, what we can find on this graphs, paragraph 1 shows the data about, but not the results. Very clearly, it's talk about the data. This is the fact that those 3 groups come with. We didn't do anything yet. We didn't do any kind of analysis of those data about the survival rate or whether the time after treatment. What the point? What the data show? What the point of presenting these data? Where is the statistical difference present? So this one, generally speaking, about the data between the difference between 3 groups, as we said, in the survival and the time after treatment. The figure on table shows the survival rate following the diagnosis and initiation of treatment in the 3 treatment groups. At 6 months, the survival rate was significantly higher. Just focus on this term. The 6 months, the survival rate was significantly higher in this group, which is niroximab and the plastide, compared with the radiation treatment group. At 12, 18, and 24 months, the survival rates in the niroximab group exceeded those of both the plastide and radiation treatment groups. So what we can feel or find on that paragraph, actually, that the author tried to give the kinds of the findings or the interpretations of those the analysis of the data presented in the first paragraph. This paragraph definitely give the findings of the results, but not the data. It is clear in the figure that the survival rate of the niroximab and plastide were higher with the significant difference. So he gave the meaning of which one is the higher than the other one and whether those significant or not. But sorry, is it just talking about the which one is higher than the other one? But the level of significance of any difference is not yet determined according to his description. If we talk about this paragraph, for example, just focus and find the difference between this and the previous one. He said that 6 months after diagnosis and initiation of treatments, survival rates in the niroximab and plastide groups, 95% and 91% respectively, were significantly higher than in the radiation treatment group, 39%, and the p less than 0.001 for both, which means significant. But the survival rate were not found to differ between this group and the plastide group, and he showed the figure on table. By 12 months, however, the patient survival rate in the niroximab was significantly higher than in the plastide groups. Give the numbers, and then a difference that become even greater at 18 and 24 months, and give the number and the level of significance. If we focus on this paragraph, we can feel very clearly that this represents both the facts, which is the data of those 3 groups, as well as the results following testing, doing a statistical analysis test between those 3 groups. Okay, so he described the important treatment differences and reports when the differences occurred and whether they were statistical significance. He could present that as a table or as a as a graph or as a table, and the table is much preferably listed because it's very clearly shows, for example, the time months and those survival rate between these 3 groups, and give a footnote. On the footnote, he just defined it as the p values between different. He just put like a letter A, small a, B, C, D, and the meaning of each one in terms of differences between those groups. So those examples of which one represent data, just the data, or results, or you can't do both together, which is a favorable one, both data and results. Regarding when we talk about the text of the result should first describe the subjects studied. This including those who enrolled and were not included or withdrew from the study. Also, the reason should be provided for this exclusion to add justification of the non-bias method, of course, in the sample selection. And the final population included in the analysis should be clearly stated. So according to the Shapiro et al. Of this study, for example, I just, we extract those paragraph about the result text. He said that 100 subjects participated in this study, each diagnosed with a mandibular first or second molar with IP. Of these 100, 1 patient did not show a profound lip numbness at 15 minutes after the initial IMB Mr. Block, and was excluded from the further data analysis. The remaining 199 subjects in the combined sample, 98 of them first molar and 101 second molar. And then he just continue his description of the population. So he should. So he stated that the whole samples enrolled and the full description on details of those enrollment and if there's any kind of exclusion or dropout, and the final numbers included in the study. And you can't do that as in terms of the flow chart to make it easier presentations for the readers also. There are certain facts about the results you have to remember. Always be concise and emphasize the important findings. If sometimes during your walls you find there's kind of irrelevant findings or not a very important one, just ignore those because it doesn't add any kind of relevant information to you as well as to the reader. Also, do not repeat information provided in tables, but highlighted the important findings and compare between them. Okay. Some of them, some of the students try to put a lot of things in the tables and try to exactly put the information as mentioned in the statistical analysis software, whether run by the SPSS or different kind of software. But to try to highlight only the relevant things that you want to do. For example, the mean and standard deviations, or whether the p-value presented and the significance levels. The result chapter typically should not include references to avoid any kind of references within the result chapter. Avoid excessive use of abbreviation, which may confuse the reader. Okay. Begin each paragraph with a topic sentence that give the reader information about the sets of data that will be revealed. Then the rest of the paragraph can be summary of the data by referring to the table or figure where the data can be found. So you have to sometimes to divide the paragraphs according to relevant information that you want to do. Generally speaking, with certain kind of sets of data you can talk about in terms of text, and then the rest of them you can refer as a paragraph 1, figure 1, 2, etc. It is preferable to provide the results that answer the studies. Okay, studies hypothesis or the primary outcome before addressing the secondary outcome. So to give the priority to the primary outcome that you expect to have following testing your hypothesis, and then if you find it's relevant to talk about the secondary one, just to make it more strong and valid, just do it. Okay, there's no problem. Usually data are summarized. Example, using the mean or median values for normal or not normal distribution. You have to know your data if it is normal distributed or not. For normal one, you have to put the median and standard deviation. For the not normal one, you have to put the median one. You have to know the difference between them. The variability of the results must be included as a standard deviation or standard error for the normally distributed, while for the not normally one, you're normally presented with the interquartile range of the distributed data. Check the consistency of the numerical results between different sections of your manuscript, such as the abstract, tables, figures, and the discussion section. Sometimes the numbers that are presented within the results, which is the main chapter talking about the numbers, when you talk about later on or previously within discussion of the abstract, for example, sometimes there's kind of mistakes done by the authors or the students, put it in a different way. So the reader, when he talk or she talk to that, you might find the differences and confusion make them. So you have to be concise and you have to put it in a similar way every time that you want to talk about that number and that value. Avoid writing highly significant and very highly significant to make your exaggerated expression. Try to write it in a simple way. If there's a difference, just say there's a difference. There's a significant difference, and that's it. And if it is not significant, there's no difference. So just ignore that. Okay, and comparing between groups, and instead mention the p-value present between groups. Okay, the past tense always it is the an official academic language used in the result as well as in the methodology chapter. The numerical, always the numerical relation between the data is suitable to be mentioned in the result chapter, while it is interpretation, correlations, and implications. If there's any kind of limitation, you have to put it in the discussion chapter. And in different parts of the discussion chapter, depends on the sequential order that you present your results and methodology before. Just let's talk about briefly about the tables and the figures and how to deal with those unimportant things of presentation, your results. Make table easy to read and follow. The tables always should be kept to the minimum necessary to answer the study hypothesis. Avoid repeating data in a subsequent tables and figures. Okay. Avoid including the whole statistical table, such as, for example, ANOVA test tables done by the SPSS, for example, program. There's a lot more information about this numerical values included within the testing in one. Not always you have to mention everything, but just focus and highlight the important things. So, for example, the name of the groups, for example, and if there's any kinds of the mean and standard deviation, and the level of significance on some of the relevant information. Sometimes we add the odd ratio or not between them. When the numbers in this table is not trusting to you or to your text description, this number is very confusing actually to the reader, and instead mention only the p-value, which is the most important one. Okay. So as much as keep the minimum necessary one and highlight the most relevant information that you want to present to the reader to show the differences between the groups. Tables should be used not only to present data, but also to show the relationship sometimes. Therefore, you should not use a series of information in tables in which the contents of one cell has no relation to the content of the adjacent cells. Always found the relationship between them in an objective way. Okay, try to avoid scattering your information. So I put, as I said, everything's in that table. Provide a concise title and legend that summarize the content of the table. This should be present on the top of the tables. Always at the top of the tables represent the type, the table number, and the titles and the meaning of that tables. And at the bottom of that tables, usually put in the footnotes and abbreviations on the what you abbreviated, what the letter abbreviated according to the numbers means for the readers, just to understand exactly what that symbol represent. Provide definitions of each abbreviation in the table, as we said, in the legends or footnotes, so the reader does not have to refer to the text. This is the point. But if you don't explain it here, always I need to go back to the text, and this makes a sort of annoying things to some of the readers. Tables should be numbered in the order that they appear in the text. So when you talk about in that paragraph in the results within the text, and you refer table 1, you have to be a table 1 in the same order, and then 2, and then table number 2, 3, and 3, and so on. So you have to be put in the same sequential number. The first column typically lists the independent variables in the row with subsequent volume presenting the dependent variables. Always, so the first one that's coming in the left represent the independent one that cannot be changed. So the independent variables are those who are manipulated or changed by the investigator, and the dependent one are the tested or the measured variable by the experiment, and their value definitely depends on the independent variables. Okay. For example, if we take one may study, for example, serum phenytoin concentration versus the prescribed dose of this. Here we have the dose and the effect of that, which is represent the cause, and the effect of that dose in terms of the serum phenytoin concentration. So definitely the dose is represent the independent variables, and the resultant serum concentration is the dependent variable. Okay, because the level on the fluctuation of those concentration depends on the dose in the primary outcome. So think of if I want to make a question of this formula, okay, I can ask a question in this way. For example, does changing the dose, which represent the cause, result in a change in the circulating phenytoin concentration, which is the effect? So by doing this, of identifying the cause and effect relationship, this is often help you to determine whether the study involves the independent and dependent variables. Okay, so always at the starting of the question or the beginning of the questions, normally come the effect of the cause one, which is the independent, and the rest of the sentence, which is the dependent, represent the effect one. So the cause and effect. Provide the actual p-value rather than terms such as the p. Sometimes a lot of authors or students, they try just to make it easy. They think that they're going to make it easy, so everything abbreviated, and this sometimes make it annoying and confusing to the readers. So instead of being p equal to ns, non-significant, or s significance, try to write that p-value, the p-value number, and then you can define that number according to the significance interval between two brackets later on. More detailed comparisons, such as paired comparison test, required a separate table to list all p-value. Try to avoid putting all of the tested hypotheses of testing analysis within the same table. It's going to be too much. You need some time to divide those tables in a separate one to make it more clear. Provide units for each measurement, preferably within the row heading of each column. Okay. For example, if you're doing the weight, you have to put the value of that weight in terms of milligram, gram, microgram, or the volume, for example, etc. So you have to define everything within the heading of your table. If we talk about the figures, figures represent a type of visual displaying of the results, help the reader to interpret these results. Therefore, ensure that all the information required is presented within that figure, such as naming or naming of both x and y axis and the meaning of x and y axis correctly and completely, avoiding use unnecessary ornaments. Some of the students, unfortunately, they try to put it as in a 3D model, a 3D style of a graph presentation, or 2D, two-dimensional graph. Just they think that is going to be more interesting. In fact, it means nothing in terms of data result presentation or data presentation. It's not a professional academic way of presenting your results here. Use a specialized program to create graphs, normally Prism or Sigma plot, rather than assemble spreadsheets. If you are using colors in paragraphs, you try to make it as simple as a background, normally white in color backgrounds, and avoid yellow and other colors that are difficult to see. Keep axis lines in black and bold black sometimes. Okay, and it's very easy to do with those softwares, and not less than size of 0.25 pt. Okay, to make it clearly presented. The figures should be numbered in the order and as in exactly the same thing within the text as we talk about in the table, the same thing. Normally, you have to provide a legend for the figures that should appear at the bottom, and the legend should start with the figure number, the title, and your description of data and all notation. Therefore, each figure should stand alone, and the reader should not have to refer to the text or to interpret data. Just focus in a minute, my dear students. Here, the legend or the figure is not is the same as in the table. The figure is a bit more have a more detail and description actually. If you remember, when you see any kind of figure legends in any kind of paper, whether the clinical or experimental one, sometimes you can notice the part of a methodology expressed on that legend. So he mentioned the meaning of that tables within the legend, some of the number, but he normally referred to the kinds of the testing used on very briefly how to do that. For example, the effect of this on the expression of that on following that using that concentration and the expression and the done by that way. So he tried to explain part of the methodology sometimes used and the effect and cause sometimes even within the legend, but not try to avoid to talk too much about it. Just very briefly summarize your findings or your findings on the methodology sometimes used to test these findings, okay? The variables presented on the x-axis are the independent normally, be the independent variables, while the y-axis usually to plot the dependent variables, which usually represent the only one variable. Here, for examples, this graph, the authors try to present the effect of two different effects of the MTP and the LPS, for example, on the expression of the mRNA expression of different markers. Okay, so they just following, they try to present the expression, the mRNA expression of those markers during following different times of treatment or the manipulation or treating with those LPS or MTP. So he just tried to put each one separately as a separate graph on the following the time of treatments. So he put it in a way very successfully presented. But you can, if you notice the figures here, the figure legend, he just tried to explain the MTP and LPS and the expression of those markers on the type of cell here stimulated with those MTP. Here you can notice the concentration for different times. The gene expression of those markers was examined by the RT-PCR. So he tried to explain sometimes very briefly the type of the equipment or the method used to testing this expression. And then he mentioned the p-values versus control. On the cells stimulated by MTP, the concentration LPS or the combination of both of them for those times. And then the gene expression level of this marker and this marker and this marker were determined by RTVM. So he tried to very briefly remind the reader about the design of this methodology used to test the expression of those markers in a very successful way and very understandable way. I think we finished today, and this is the references also. If you want, any one of you just to read more about the references describing the result chapters as well as all previous topics that we talked previously. And we finished today about talking very briefly about the certain facts that you have to remember when you're writing the result chapter, just to make your story very simple, complete, and successfully presented. If you want to understand about the statistical kind of testing those results and which one you use, I think you need to refer to the specified titles of those testings, and you read more about how can you, in terms of statistical analysis, how can you use those. This is actually different topics that you need to go further about and to discover how to deal with your results in this way. But for now, I finished that part of the referencing of the result chapter. Hopefully, I'm going to meet you next week when we talk about the discussion on our last chapters of the research writing and find the relevant information. Hopefully, it's going to be useful for you to write your thesis in a good way. I'm so happy to present this, and I'm ready to have any kind of a question in person. If you can come to my departments, if you have any kind of anything's not clear or you want to ask more in terms of to make it very clear to you about this lecture or even previous lectures, I'm so grateful to answer and to explain everything for you. Good luck and see you next week. Bye-bye.